Hi, my name is Caleb Lewis, and I'd like to welcome you to the Simulation Center here at Missouri Southern State University. Our Simulation Center is here to help you succeed as a student in our healthcare programs. As a student, one of the most common skills you will practice is how to do proper patient assessment. There are many types of assessments you will learn within your program, but knowing how to take patient vital signs is crucial. These patient vitals include listening to the heart and lung sounds, taking a pulse rate, a blood pressure, counting respirations, and measuring pulse oximetry. The Simulation Center, as well as all skills labs in the nursing and respiratory therapy departments, use Hill-Rom patient beds. You will need to know how to properly operate these beds to provide patient care. These beds have a control module on both head rails and enable the student to raise and lower the foot of the bed, the head of the bed, and the bed as a whole. Behind the head of the bed, you will notice a red CPR handle that, when pulled, lowers the head of the bed quickly in order for the student to provide chest compressions. Each bed has locking and unlocking pedals at the foot and head of the bed. These pedals have 3 positions, one for locking, one for unlocking, and one for steering. There are 2 sharps containers located next to the 2 entrances to the Simulation Center. These containers are for the disposal of used sharp devices like needles, syringes, ampules, vials, or any other hazardous waste equipment. This container should not be used as a regular waste receptacle. Behind each bed is a headwall unit which has many functions. The headwall unit has light switches to control the lights located above the bed, electrical outlets for medical equipment, and a simulated red outlet signifying backup generator power. The headwall unit also has outlets for oxygen, medical compressed air, and vacuum usage. 2 audio alarm buttons can also be found on the headwall unit. The red alarm signifies a patient call button, and the blue alarm button signifies a code blue alarm for a patient in cardiorespiratory arrest. There are 2 hand-washing stations located in the Simulation Center, one on each side of the lab. These sinks are touchless, and there are soap and towel dispensers above the sink. There is also a hand sanitizer dispenser above the sink as well. Students will need to use these dispensers just as you would in a clinical environment. Two linen baskets are available within the simulation lab for dirty linens only. These are not regular waste receptacles. Two medical equipment carts can also be found within the lab. The red cart is the crash cart used for supplying equipment needed for a patient in cardiorespiratory arrest. This cart has a fully functional defibrillator, simulated medication, and various other supplies. The yellow cart is our isolation cart. This cart supplies personal protective equipment like masks, gloves, and gowns for students. Each patient bed in the simulation lab provides patient monitors which display various patient vital signs and other information that may be needed for patient evaluation. These patient monitors are touch-enabled, so students can quickly choose what information they'd like displayed. Faculty and staff can also manipulate the patient monitor to display as much or as little information on the screen based on what is needed for the particular patient scenario. The most common screen layout students will use is the 3-waveform screen. This layout provides a touch-enabled ECG waveform that will provide a heart rate value with a corresponding heart rhythm, an end-tidal CO2 waveform with a corresponding value, plus the current value for a respiratory rate. A pulse oximetry for SpO2 waveform and corresponding value can also be provided, but this is not touch-enabled. This value is generated by placing the pulse oximeter probe on one of the mannequin or standardized patient fingers. Once this has been done, a waveform and value for SpO2 will be displayed. Other touch-enabled vitals that students will use is the NIBP, or non-invasive blood pressure value, and the patient temperature value, which is signified by the TPERI symbol. To activate the NIBP value, the student will need to touch the screen where it says NIBP and then either press Start from the window that pops up or on the bottom of the menu bar located here. The patient temperature value, if not provided, may need to be started from the window that pops up by simply touching the TPERI symbol. The menu bar located at the bottom of the patient monitor screen also provides important information for students. This menu bar can initiate the NIBP value, provide a real-time 12-lead cardiac rhythm, lab reports, and radiology images if available. The medication supply room down the hall from the simulation center contains a med dispensing system which allows students to access simulated medications for the purpose of patient medication delivery. To access medications, you will need to first log in, which can be done using the keyboard or the touchscreen. Depending on your program, there is a separate login and password for nursing and respiratory students. You will find the login and password posted on the wall above the med dispense. Once you have successfully logged in, a message will appear letting the student know that the medications and patient names are fictitious and for simulation purposes only. The next screen is a list of patient names that can be found in the system. This screen allows a student to choose the name of the patient they are currently taking care of. Once the patient name has been selected, the software will transition to the patient medication profile screen. This screen allows the students to choose a medication and a quantity needed. The student can be allowed to choose as many medications as needed within this screen. When the student is ready to access the medication, he or she will need to select the Open Drawer tab at the bottom of the screen. Once selected, the appropriate drawer will open up and the student will be alerted to which section of the drawer the medication is located by following the prompts on the screen. When the student is done retrieving all of the medications necessary, he or she will need to close the drawer and log off of the med dispense system before leaving the room. I hope this video has helped familiarize yourself with the Simulation Center and some of the equipment that you'll be using.